We have an update from emergency management staff regarding the coronavirus and how York County is staying prepared. Thank you, sir.
Good evening, Mr. Chairman and Council. This is just an update on the coronavirus that's dominating the headlines nationally and throughout the world, and we're all keeping a close eye on it. I want to kind of speak on what emergency management, your local emergency management office is doing and what we do and how we fit into DHEC's plan and the CDC's plan. Currently, everyone wants answers to questions that we don't have the answers to, and we're just as interested in that information as you are. Almost daily, we get information updates from the Department of Health and Environmental Control, which by state statute is the public health authority for South Carolina. There is no county equivalent counterpart to that public health preparedness piece. So we work with them, and their plans is to manage the crisis side of it. CDC, DHEC manages the early stages, prediction, vaccines, all the many things that comes along with early detection, and then the emergency management piece is the consequences of what happens. So they're sort of on the front end of it, and we're sort of on the back end, and we have had plans in place since the mid-2000s, back when H1N1, swine flu, bird flu, all the other flus were the topic of the day. But currently right now in South Carolina, there has been no cases. U.S. has had 22 cases, and only 2 cases have been person to person, although those are the most concerning. DHEC and CDC has been predicting the arrival of this disease or virus for weeks now, and have been ramping up their plans as such. Currently, the only spread in the U.S. has been in California, Oregon, and Washington. Their recommendations, which we also promote, is exactly what you would do for the flu. So good hand washing, good hygiene, staying at home if you're sick, keeping your kids home from school if they're sick. And so our job at this time is basically brokers of information to pass on those tips. Although still much is yet to be learned, right now the average U.S. citizen, us, has a very low risk for contracting the virus, and a very low risk of actually having any other issues other than normal seasonal flu-like symptoms. There are plans in place locally for medical surge issues. Our hospital and hospitals in the area work with the South Carolina and North Carolina public health preparedness programs to identify beds in which may be needed, and this is not unusual. You may remember and recall standalone beds were set up several occasions for seasonal flu, just to keep the flu outside of the hospital. That is, you may see that, especially in other countries, as it ramps up. So right now, the plans for monitoring, quarantining, the medical surge side, and the supply interruption could be something we're faced with. But this is not unusual to the normal seasonal flu planning that we do already. Thankfully, this coronavirus, that the novel strain of it that we're seeing, the mortality rate is not as high as some people are projecting, although those numbers can change. Right now, we think it's very much controlled, and the plans that have been in place for a long time are well funded and well practiced. Any questions?
I think we're good.
All right.
Thank you for the
Thank
update.